Local3news.com.
Okay, you may have a fall wreath on your door, but that summertime weather is still very much here. So Dr. Luke Maxfield with Aspire Dermatology and Skin Surgery Center is back on the show, and you thought people are still going to be hitting the pool, wanting to get those last remnants of a suntan in before the fall and winter weather gets here. Skin cancer is a big thing to talk about.
Right, so a big part of what I do is taking care of the product of sun damage. So yes, I mean, like I said, summer is hanging on for dear life. It's going to be hot as can be today. But the skin cancer changes accumulate over time. So whether it's from the summer or whether it's from the sun you had or the sunburn you had 30 years ago, 40 years ago, all of that accumulates in your DNA and then we develop skin cancers over time. So
okay, so she might skin me, pardon the pun. But my younger daughter in college, her freshman year, had to write a paper, and it was some kind of like a self-reflective, just make your argument paper. Not long. But her topic was how girls always feel better when they have a tan, which is a true thing. So it is, I guess, historically true that when you're young, you don't always think about the repercussions of your actions 30 years down the road, right? So what you were just talking about, if you're 22, you could still be developing some things that will show up when you're 42. Is that right?
Absolutely. One of the most common questions I get from patients is they'll tell me, hey, I haven't been in the sun in 20 years. I don't know where the skin cancer came from, and unfortunately, it's just life lived. It's the damage you did in your teens, it's the damage you did in your 20s. It could even be damage you did as a child, and obviously you don't have a huge hand in that, but all of that does add up over time. Your body holds on to it until there is a shift in, honestly, our immune system over time, where the damage accumulates, crosses a threshold, and these skin cancers develop.
So you hear the word cancer and you get a little bit concerned, and yet in your world there are sort of tiers of it. So knowing how to identify, like basal cell. Most people either know somebody or have themselves had a basal cell carcinoma. Am I saying that right?
That is absolutely correct.
Don't I sound smart? Okay, so what do those look like?
Right, so this is going to be to equip you on how to identify these as best you can at home. Like, this is your starting point. So you mentioned basal cell skin cancers, basal cell carcinoma. This is the most common skin cancer. That is it. So what we're looking at is an eye, and then down and to the left, or I'm not sure how it appears to you, but down below the eye, we have this pearly bump, or papule as we call it. This one has a little bit of central erosion, and that's one of the key features that I think people can recognize at home.
Like the crater?
Yep, that little crater with a little bit of scab. It's like this non-healing sore that just won't go away. It's been there for months, and these are subtle as can be. This is why people often wait a long time. They don't hurt. They sometimes just look like a little pimple, and even as a professional, the initial changes can be extremely subtle, but pearly, dilated blood vessels, non-healing sore, the most common type. Most of the time, if not almost every time, it's not going to affect your overall health, but as you can see here, it's close to the eye, and it's really common that these will invade, grow, and consume adjacent structures, and so on
like
the face.
Nose, eye, that kind of thing. So can you leave it alone, or do you need to have it removed?
The earlier you get it removed, the better off it'll be. Just
okay.
Believe me. I think it's reasonable. Some people say, you know, it doesn't hurt. I'm 85 years old, or I'm 80 years old, 70 years old. What happens if I leave it alone? And the truth of it is, it's just easier to treat when they're small.
Okay.
Down the road, it gets a lot bigger.
All right, is it squamous or squamous?
I don't think there's a right or wrong answer.
Tomato, tomato?
Tomato, tomato, potato, potato.
Okay, but you say?
I say squamous cell.
Okay.
Perhaps it sounds more dignified. Perhaps that's just how I learned it first. But
that's it?
This is it. So this one is the second most common type of skin cancer. This is a close-up somewhere on the body, somewhere on skin. Who knows?
Okay.
Probably on the back of perhaps even the hand. Obviously a very close-up shot.
So it looks like a sci-fi movie, but but you've obviously magnified that image quite a bit. So in real life, is it tiny?
They can be a variety of sizes. For this and basal cell, I've seen them the size of an eraser head. I've seen them the size of your fist, and I've treated both. And obviously with this one, it makes a big, big difference in terms of how it behaves long term. So when these are small, they behave very well, meaning that the risk of metastasis spreading throughout your body and taking your life is very low. Over time though, as they get bigger, they grow deeper roots, they continue to mutate. This actually can be life-threatening.
Because this one's growing down, correct?
And there's a risk of it spreading throughout the body.
Okay.
And especially on the lips or the ears, they have a relatively high risk of metastasis. Okay. And so what you're looking for is a fixed, firm, scaly spot that really, again, just does not go away in a chronically sun-damaged area.
Always white?
Nope, not always. Sometimes they can have more skin color, but there usually is some form of scale and firm quality to them.
Okay, I know we're going to get to melanoma, which is often one that changes shape. Did these change shape?
They do. Almost all of these skin cancers are dynamic, meaning that they do grow with time, because that's cancer in general. Cancers do not stop growing. There are some genetic changes, and so they do change. These can pop up extremely quickly or over the course of a couple of years.
But it will be in a spot that's been exposed to the sun.
Almost always. There are some other nuances with wart-induced squamous cell, but most sun damage.
They're telling me I'm down to 2 minutes, so let's hit the melanoma, because that's the granddaddy.
Right, so this one, melanomas. This is a skin cancer of the common skin cancers is the most deadly. This accounts for the most life years lost, meaning that it affects younger individuals and steals the most prospective life from people overall in terms of all cancers. And these can be dark, they change colors, they can grow, and they're from a melanocyte, which again has a high propensity to spread.
So this one looks different than the others because it's an irregular shape. Is that a telltale sign?
Yep, there are the A, B, C, D, E's, and we have asymmetry, border is irregular, color is irregular, like more than 3 colors, diameter bigger than a pencil eraser, and they evolve or change. Those are kind of your telltale signs.
So if you're seeing that, run, don't walk to make your appointment. Okay, then the last one is?
This is something almost everybody has, and I only threw this one in because everybody, if you look in the mirror, on your back, under your breasts, on your abdomen, this is another dark, scaly, changing lesion. And so not all spots are bad spots, not all scaly spots are bad, not all dark spots are bad. But this is a mimic, but really it can be difficult, so you probably will need a professional to distinguish definitively this versus a melanoma. Seborrheic keratosis is this name.
Well, he would love to be that professional. It's Aspire Dermatology and Skin Surgery Center. He is so happy to be here. He's out in the Soddy Daisy area. He's finally moved in full-time, and we couldn't be happier. You can find him at aspiredermatologytn.com or call him 712-9301. Thanks.
A simple step can lead to unexpected consequences. Navigating the aftermath of a slip or fall isn't straightforward. If you've been injured on someone else's property, contact Watermark